my dentures fall out if I laugh too hard?
Okay, well, it depends. Most of the times, your denture should fit in nicely. However, over time, if you lose more teeth or your gum resorbs, your dentures may not fit so well. In such cases, it may be better to make a new denture.
Hi, I'm Liyue. I'm a geriatric doctor from Alexandra Hospital.
And I'm Meena, a dental consultant from Alexandra Hospital. And today we're here to answer your questions on dental care for older adults.
The first question we have today is, why do older adults lose their teeth?
Tooth decay happens when the acid produced by bacteria in your dental plaque dissolves your tooth structure, resulting in the breakdown and cavitation of your tooth. Over time, if not treated, the hole will continue to grow bigger. This will result in the need to extract the teeth. On the other hand, gum disease happens when there is infection around the gums, resulting in gum swelling, bleeding, bone loss around the teeth. Over time, you may need to remove the teeth because the teeth are progressively more mobile.
So the next question is, my 70-year-old dad often complains about food being too hard to bite. What can we do about it?
The intraoral causes to this could be presence of missing teeth, ill-fitting dentures. Extraorally, it could also be a sign of a weakening of the muscles, especially with patients with neuromuscular diseases. Liyue, do you have anything to add?
Physiological changes with aging can actually have implications on a person's nutritional status. Malnutrition actually has significant implications on the patient's overall health. One of the ways we can do is to chop up the food in smaller pieces. The other thing we can do is to get a dietitian on board to recommend some of the oral nutritional supplements to supplement the existing diet.
Okay, next question. Finding it difficult to help a loved one with dementia brush their teeth.
Dealing with persons with dementia can be very challenging at times. Some of the tips and tricks that we teach caregivers is to speak slowly, use some non-verbal cues and gestures to actually guide them. You can also use pictorial diagrams also to explain to the older adult what you're about to do next. Would you like to demonstrate to our audience?
Sure. You want to choose a soft bristled toothbrush. Angle your toothbrush 45 degrees towards the gums. Brush the area in soft, circular jiggling motions. Certain areas may be difficult to reach with just toothbrush alone, and that's when we recommend the use of either a floss or an interdental brush. So with an interdental brush, you actually use it like a toothpick. As you go in, you want to press the brush against the tooth surface so that you make sure you clean the area well. You may want to also get a gauze and wrap it around your fingers and clean the soft tissue surfaces of the mouth. In patients who have difficulty swallowing, instead of using the toothpaste, you may want to just dip your toothbrush in a chlorhexidine mouth rinse, dab it dry, and then you can brush the teeth as normal.
So the next question is bad breath something to be concerned about?
Yes, definitely. Bad breath can be a sign of oral diseases such as tooth decay or gum disease, and so it's important that we take good care of our oral hygiene to prevent these problems. Visiting the dentist every 6 months to a year is also important so that if there's any issues, we catch it early to prevent it from getting worse.
Maintaining oral hygiene is very important and it's often neglected in older adults. It can also affect your overall health as well as well-being and quality of life. When my dentures fall out if I laugh too hard?
Okay, well, it depends. Most of the times, your denture should fit in nicely. However, over time, if you lose more teeth or your gum resorbs, your dentures may not fit so well. In such cases, it may be better to make a new denture. So if you have lost too many teeth or if your gums is really flat because you've lost too much bone, your denture may not be able to stay on that well in the mouth. In such cases, we may recommend the use of implants to retain the denture or the use of denture adhesive to keep them in place.
So now we're on the last question. Is it important to visit the dentist if I don't have any problems?
In the early stages of tooth decay or even gum disease, you may not have any symptoms, but you do want to have your oral health checked before it is too late. Do you also know that there are actually associations between oral health and general health?
So there are certain medical conditions that actually are associated with poor oral hygiene. This includes an increased risk of cardiovascular disease, diabetes, as well as dementia. For patients with swallowing impairment, they are also at the risk of chest infections. So for those patients who have osteoporosis, it will be good to get a dental review regularly so as to minimize your risk of getting side effects from the osteoporosis medication. Thanks for watching this episode of Ask Lokun.
We hope that we've answered some of your teething questions. Look out for our next episode. Bye.